Tonight, county health leaders put pressure on the governor. They want clarity on whether parts of the state could return to stay-at-home orders.
This comes as Colorado breaks another record with nearly 3,900 new cases of COVID. Lines for testing are long as more and more people are feeling symptoms. This is the public testing site at Waterworld in Federal Heights, where long lines of cars are seen just about every day. The number of people hospitalized is skyrocketing. It is up to more than 1,100 tonight. People with confirmed cases, that number has jumped by 300 in just the past week, and it's now above the last peak we saw way back in April. Now, a key metric health officials use to determine restrictions is called the 2-week cumulative incidence. That's the number of cases per 100,000 people. As you can see from this map of the counties, much of Colorado is in the red. That's not good. All of those counties would be subject to stay-at-home orders if the counties or the governor made that call. But that hasn't happened yet, and now a group of public health officials wants to know why. Colorado Public Radio broke the news of a letter they sent out outlining serious concerns. Alan Janae has been looking into that letter, and Alan, we could be closer to the severe restrictions we saw last spring.
A lot of talk about that. This letter comes from the leaders of local health departments around the metro area, Jim. They say that while the CDPHE has given extra time for some communities to try and meet guidelines, well, there could be a problem with that, they're indicating. It is strong medicine to up the level on the COVID dial. But they say by the time the CDPHE gets around to it, it may be too late to be effective. In this salon downtown called At the Shop, owner Erica Haney is about to celebrate a year in business, wondering what's next.
You just don't know what you're going to wake up to.
Since reopening, they've been making things work with masks and distancing. Now there's word of another possible shutdown.
Without money, how do you run your business?
With cases spiraling, local health leaders are telling the state in the letter the pain they're trying to avoid by not turning some counties up to a higher level on the COVID dial, they may ultimately prolong. Jeffco's director of community health signed on.
The virus knows no boundaries. The virus is going to go across county lines, municipalities, throughout the state, throughout the nation, throughout the world.
People can easily cross borders to find services like a hair salon. It might be more equitable.
Because if Jefferson County were to say, we're going into the red zone on the dial, and then Boulder and Broomfield and Denver and Douglas all around us are saying, no, we're not doing that, we're really not making an impact on disease in the same way.
Erica doesn't like the sound of it, but understands.
Yeah, that's really scary, and doesn't seem fair. But I also feel like it might be better if we all were the same so we can kind of get on track together.
Well, the governor's office replied with a statement noting that local communities have always had the ability to enact restrictions beyond those on the COVID dial. But there is something else some health officials will tell you, that if they up those restrictions, that often comes with political blowback that maybe they believe is better dealt with by the governor's office. In Denver, I'm Alan Janae, covering Colorado First.